Hello. What I'm going to do today is I'm going to run you through one of my medical kits. This isn't a first aid kit per se. It covers a number of different scenarios. I have a separate kit which has got lots of dressings and bandages and stuff you'd normally find in a standard first aid kit, but this is an additional kit with some extra bits and pieces in it. So it actually comes in two parts. In this and in different configurations. So in this part I have a main pack which contains all the dressings and instruments, and then the secondary pack which contains sort of medications and other products. Depending on what I'm going to do, I might carry one or the other pack. If I'm in an urban situation and I want something which is not military, I have a separate bag which I can repack all this stuff into. A lot of the stuff I have duplicates of in any case, so it's just a few items that move in between. So today I'm going to leave the medicines for another video, but today we're going to have a look at the main pack, so I'll just put this to the side at the moment. So in this particular pack, this is actually built around a Team Medics pouch, a British Army one. This one was manufactured in 2015, I believe. There's a label on the back, if you can see that at all. There we go. This is a Team Medic pack used by the British Army. It's designed to fit on both a Molle system with the various connections and the old Bergens, which had zip pouches on it as well, so it can fit on either, or it can be just carried as a single pack on its own, which is what I mostly use it for. So on the front, as you can see, I've mounted a tourniquet holder. So in the UK, where I'm based, it's fairly unlikely I'll need a tourniquet. But if I do need one, I'd like to get to it quickly. So that's why it's on the front of the pouch. And if I should need a second device, I have one inside as well. So it's a quick release pouch. It's a melee attachment. It attaches to the main body. So to get it out, you lift both of them, and then you can just pull it out of the pouch. Behind there is also a pair of tough cut scissors. So if I needed to get to a casualty's clothing, to look at wounds, or to do CPR or something quite quickly, I could just cut through the clothing without going through the rest of the pack. With this one, there's a separate tab on top, which you pull back, and then the scissors come out there. They're just held in by this loop. So yeah, so the pack itself, just going to measure it. So it's approximately 12 inches 30 centimeters long by 8 inches 20 centimeters across, and then about 6 inches or 15 centimeters deep. So having measured it, I'm going to try and weigh it now just to see what it comes to. So this isn't meant to be a lightweight carry pack. It normally sits in the boot of my car. So I'm just going to place it on some scales. These are kitchen scales, so hopefully it won't fall off. I'll just check that weight. And that is 2.2 kilos. So not too bad. So just take that off a second, put the scales to one side. Okay, so the pack itself, there's two zips on top. They do up, so I was just changing some stuff around earlier. You can see as well that the zip is protected by a lip, stop corrosion. They're good sturdy zips like everything else in the army. They go all the way round, so I'll just open it up. I'm just doing this gently, trying not to knock the camera over. And there we have it. So some of this equipment is still in it, would be in a normal Team Medics pouch, but a lot of it has been changed out. The original Team Medic would be somebody that looked after, a patrol or a group of soldiers. So they would have multiple copies of the same stuff. So there'd be more tourniquets, more dressings, and other things duplicated in it. But now I've more personalised it, so I have a wide range of capabilities, and it suits more purposes. So the top thing you can see here, this is a bulb suction device. If you can see that okay. So this is for clearing airways. Certainly in combat situations, the two biggest killer are loss of an airway and hemorrhage. So this is what the medical kits were most suited for. So we have suction to clear an airway, most useful and often overlooked item. Okay, also in the airway section, if I can find it, we have some nasal pharyngeal airways. So these are airways that are inserted up your nostrils. They are by far the best of the small airways. Very light, easy to carry. The British Army normally carries just one size 7 in their personal first aid kits. And that's the most useful for securing a good airway. I have a separate video which goes through different airway techniques if you want to have a look on the channel. So I demonstrate how to put these things in. Okay, so that's the main part of the airway section. There's also, which could come under airway as well, there's one of these devices. This is called an ARDS. So this is a decompression needle. So if somebody has a pneumothorax, so that's air trapped in the pleural cavity, and we need to release that air, we can use this to puncture through the chest wall and release the air out of it. So this one is actually one I've opened for another video, and it is essentially it's a cannula, but it's compared to other types of cannulas, this is quite a wide bore. It's got a very sharp needle on the end, and this is very tough compared to a lot of cannulas, but it's meant to punch you through the chest. So just pop that back in there. So that's the airway section. So if next we go on to wounds, which is probably the biggest section, and we have quite a few things. So I'll just move this back a bit so we can put some stuff on the table. So I have a number of different dressings in here and the devices. So we have the second tourniquet, should a second one be required. So, you know, in the unlikely event of needing the tourniquet, sometimes one won't stem the bleeding, so you can apply a second to the same limb. Or in the very unlikely event you have somebody that's been in the vicinity of an explosion, they might have multiple limb trauma, in which case you might need a second. So some other dressings I have in here. I've got some standard first aid dressings. These are medium first aid dressings just for normal type wounds. I've also have a crepe bandage in case you need to secure anything, and then a second crepe as well. Okay, so I just move those to one side. Now onto the more serious stuff. So the first dressing I have is a specialist dressing. So this is an Olay's modular bandage. I'll do a separate video explaining how this works. It is the Swiss Army knife of dressings, and I don't have shares in the company, but I can't recommend this one highly enough. It is very good. It's carried by the police in the UK, the ambulance service, and is is multifunctional. So a very interesting item. So the big brother for the Olays is blast bandage. So we'll take that one out. This is a large bandage. It has a very big pad, and again I'll demonstrate this in a different video. It is mainly used for amputations because it can wrap around the stump, and I'll explain that in more detail at another point. But it can also be used for like an abdominal wound or for a large area of burns if you put something underneath it, because it has a very big pad on it, much bigger than standard dressings, and you can see it is quite bulky. These are all vacuum packed as well, so once you let the air out, it's very difficult to get them back in the bag. Okay, so the third specialist item I have is Celox. So this is Celox gauze. This is impregnated with a compound which causes blood to clot. So if you have a wound with cavitation, so you have a hole, so these type of dressings are not meant to be laid on top of wounds like other dressings. These are meant to be packing wounds. The compound inside is reacts with blood, reacts with liquid, and causes clotting to occur. So it is very good at stopping things bleeding. You can get smaller civilian versions of it, but this is the military version. It's in quite a big role, primarily for use in gunshot wounds. But also from a civilian point of view, a lot of these stuff, if you use heavy tools or chainsaws or something like that, you can get some very nasty injuries from these as well. So I've got several pairs of gloves which are stuffed all over the place. So these are nitrile gloves, so they're non-allergic ones. They don't necessarily cause allergies. They're in pairs already, so they're easy to grab. So that will cover a lot of things. If you don't have blood on your hands, then you don't really need to use gloves. So in an emergency, I wouldn't stop to put gloves on. But if I had a cut on my hands and I was afraid of cross-infection, then I'd use those. And if I was doing any sort of clean procedure, then I'd wear gloves. So we just pop these again to the side, give us more space. Okay, some other stuff I've got in here. So I've got some tape. So tape's good for attaching all sorts of things. We also have some triangular bandages. So I believe in the States these are called cravats or cravat bandages. So they're the ones you'd normally see people using as slings, but you can also use them for scalp bandaging and other stuff as well, which we can cover at a later date. And then I have the obligatory, what they call a boohoo kit. So this is a variety of different stuff in here. There is there's actually a foil blanket in the middle of it, but there's also some adhesive plasters, some blister plasters, some wound wipes, and some steri strips as well, I believe. So steri strips will be part of our wound closure. So there's some there, there's a couple more somewhere else. But those are the wound strips. So these are for small wounds. The wound closure strips are quite useful, can cover a number of different scenarios, and are very good for pulling wounds together. So let's pop that down. Okay, so I'm just going to move this back slightly. Okay, and I'll make some space so I can put some more stuff out. Afterwards I'll have to get this all back in the bag. Another thing you might not see in a standard first aid kit is a flexible splint. So this is good if you've got somebody who's got like a lower arm injury or hand fracture or wrist fracture. I can do a separate video on these, but essentially you roll them out, and although it's very malleable when it's in its sort of flat state, what you can do is once you kink it, so if you make it into a gutter shape, then it's much solider. And what you can do as well is you can, if you bend the ends over again, so you make it into a W shape. I won't do the whole thing, but just to show you what I mean. So if you make it into a W shape like that, it makes it even stronger. So now, whereas before it was quite floppy, now it's quite hard, and you can use that to support an injured limb, like a lower arm, or maybe bend it in two and use it around an elbow or an ankle. You can get longer ones of these. They come in various sizes, so they have a variety of purposes. So let's put that one side. Okay, so what else I've got in here? I've got a standard Israeli dressing, or an emergency bandage they're called. So it's a standard military dressing. It's bigger than your civilian dressings, but not as big as some of the more specialist dressings I showed you earlier. Other stuff, hand sanitizer. So you're not going to have much water when you're out and about, so it's a good thing to clean your hands. I've also got a pack of wet wipes again, so you could use these for cleaning surfaces if you have that luxury, or again just giving your hands a quick wipe over. And then we're on to the, with your personal protection as well. I've got some surgical masks. So these are mainly so if we have any sort of pandemic or casualty with a respiratory illness. They're not terribly effective, but you know, better than nothing. So moving on to the back pouch. Let's move this along a little bit. So the section in here, I've got some burns. Oh no, before we get to those, a couple of things in here. So I've got some chest seals. So if you've got anybody with a open chest wound, you can use these for sealing the chest. Again, we can talk about these in a separate video. There's quite a lot of specialist equipment here, and if you're not used to it, you know, some of it might need some further explanation. On the wound closure, I've also got a wound staple gun. So this is like your office staple gun. It comes with, if you can see them in there, sort of they're lined up along there. So with this, you don't need a second surface to press it against. It just fires the staples into the wound. So if you need to close a wound like a scalp wound quickly, which is bleeding a lot, these are very good. And they're relatively painless as well. Well, not that painful, whereas suturing can be quite painful for people. Okay, so other stuff I've got. On the examination section, I have a pulse oximeter. So I think I've taken the battery out of this so I take one battery out of it so it doesn't accidentally switch on. But I have spare batteries in the pouch. So just pop that in there and you can see how it works. Back in. There we go. So if I switch that on, put my finger in. I'm a bit chilly today, so we'll see if it actually picks up my pulse. There we go. So obviously I'm excited about talking to you, so because my pulse is apparently 111, but I think that's just it takes some little time to warm up, and I have oxygen saturations at 97, which is good. So I'm sure that'll go down in a second. There we go. So I'll take that off for a sec. See if I calm down later. And other diagnostic things I have. So I have a pen torch. So this is for primarily checking pupil reactions. And you can see along the side there's a scale, so you can gauge somebody's pupils, see how big they are. So 3 or 4 is probably about normal for most people. So if they got very small pupils, that can be an indication of head trauma or opiate overdose. And then very large pupils again can be drug induced, and it can also be head injury. So we want things nicely in the middle. This particular torch has a blue light filter built into it. So if I just move the sheath on. So you can see it shines with a blue light, and get that in the camera. So you can take that bit off, but the blue light is used when we're putting dyes and things into the eyes. So if I was going to look for somebody that had a corneal abrasion, so some potential damage to the eye from dust or foreign matter in the air, or had some sort of eye infection, I can use the blue light, and it makes the examination more easy. Okay, so other diagnostic things I have. So I've got a digital thermometer. Particularly important nowadays with the amount of respiratory infections and things you can get. The thermal ones and the ones you put in people's ears are often easier to use, but they're much more bulky to carry, so this is a lightweight option. I have a tongue depressor in case I want to do any ENT, so looking down people's throats, etc. You could also use it as a finger splint if you wanted to. I have a stethoscope. So this is a Lippmann stethoscope. It's a Lippmann cardiology stethoscope, so this is quite an expensive one. Because I work in medicine professionally, this is something I use in work. But you can get much cheaper ones, because these are like over £100 each. So, but a much cheaper one would be more affordable. But the more you pay, the better instrument you get. So other bits, I've got some instruments as well. So I've got a sealed scalpel blade. So if I need to do any sort of cutting abscesses or doing a surgical airway or something like that, I can use that. I have a few cannulas of different sizes, so if I need to give somebody drugs, so these could go in the drugs module, but there's just more space in this bag to accommodate them, so this is why they're in here. Have some eye wash solution, so this can be used for irrigating wounds or for eyes. If you've got chemical burns in eyes, you need a lot more fluid than it would be in here, but it's better than nothing. A pen for writing casualty notes. China graph pencil, so this is, you can write on people. So if I was to give somebody drugs or apply a tourniquet or something, I could write on their forehead, so people would know that those measures have been taken. Have some burns dressings, so various sizes. So these are very handy. They're not widely used in the UK anymore because ambulance services used to carry them, but now a lot of A&Es don't like them to be on the patient when they come in. But if you're, because they just make a mess. But if you're in a isolated area and you've got no clean running water to cool the wound, they're very good for that purpose. Excuse me. So other bits and pieces I've got, another thing on wound closure. So I've got some tissue adhesive. This is like medical super glue. It can be used for closing wounds. I have some compressed gauze. So I think there's about 30 yards in these packets. So again, this is something for filling a hole. So for somebody who's got a puncture wound, might have impaled himself or something, and that item has come out, and we can use that to pack the wound. And I'll do a separate video on wound packing, so you can have a better idea about that. There's some more wound glue. I have some suture instruments, so a set of forceps and scissors. So there is some sutures in that small pack I showed you earlier, so that just helps with suturing, should I need to do any. Some more eye wash. A pair of forceps as well for the suturing. 2 more spare batteries. These can go in either the pulse oximeter or the pen torch should I need to recharge it. Also have a head torch in my other kit, which is useful. They all use the same battery, so it's good to have one standard side. There's one of the sutures, so this is a spare suture, if I need to do any suturing, and I can do a video on this if people are interested. And I got some tick tweezers as well, they are quite useful if you're outdoors. So I think that's most things that are in there. Oh yes, there is another pocket at the back. So underneath this zip here, there's another pocket. And in here, there's normally a pack of gauze. Now I took this out earlier because I was changing it to some stuff that was in date. So I've just got some in my other bag, so I'll just show you that. So what would normally be in here is a pack of gauze. So it has different size gauze. So this can be used for cleaning wounds, for as a dressing in itself with some tape. And maybe as an additional pad if you need something to soak up blood. So that's quite good, and that normally sits in this back pouch right here. Okay, so I made a bit mess of the table, but you can see generally what sort of stuff I carry in the pack. And I hope you found that interesting. If you've got any more suggestions of things I could put in, I have sort of really stuffed things in there, and I've got lots of other stuff I could potentially put in, but I've just tried to rationalise what stuff I'm more likely to need in a variety of situations. More than happy to receive any comments, and if you want to put comments about your own kit or pictures of your own equipment in the comments on YouTube, I'll be very interested to see those. So thank you very much. We'll see you next time. Bye.